Welcome back. We are answering your questions about the coronavirus with Cone Health's Chief Physician Executive, Dr. Bruce Soers, and you can text your questions. And again, this is text only, do not call. Some of you may be just joining us, and this text question kind of alludes to that, and there's nothing wrong with asking a question a second time to make sure that everybody knows what's going on. This person says, are appointments with Cone at the Coliseum tomorrow still good?
So I'm going to assume that that's a second vaccine. So folks who have an appointment for the second vaccine, those appointments are still good for tomorrow, yes. Otherwise, first dose appointments are canceled for tomorrow.
Okay, we want to make sure that you hear that. Any first dose appointments are canceled for tomorrow. This person's asking, do you need a COVID test before you get the vaccine?
No. There's no reason to get a COVID test before you receive the vaccine, period.
This next question is, I signed up for a reservation about a week ago. Will I need to sign up again with all of this switching of days and things of that nature?
Yeah, really good question. We don't anticipate that you will have to sign up again. We anticipate that we will reach out to you, and you'll be in the queue for us to reach out to, and we'll reschedule it for you. This is changing really day to day, moment by moment, and so you might stay tuned to news stations, read on our website about the process, because things may change, but the anticipation right now is we'll reach out to you.
This person is asking, if you take blood thinners, should you stop taking them prior to taking the vaccine?
Generally not. You might want to run that question by your physician who manages your blood thinner. There might be rare circumstances where you might need to be careful, but it's very similar to receiving a flu immunization that you don't have to stop any medications. Stop by, get the vaccine, and you're on your way.
Mm-hmm. This person says, I tested negative on Wednesday. My wife then tested positive on Sunday. Should I get tested again?
The first thing you should do is stay quarantined, both away from your wife and away from everyone else. So you are at some risk of getting the virus from your wife because of close proximity. So separate from each other in your home. So that's the first thing. If you were to get symptoms, yes, it might make sense to get tested. If you actually get tested if you have symptoms. If you're in a situation where you have to go to work, so for example, if you worked at Cone Health, we'd have a process for screening you, and yes, you'd likely get tested 4 or 5 days after exposure and maybe later on. So it all depends on your situation. Most people don't absolutely necessarily need to get tested after an exposure.
Mm-hmm. But they should stay home and quarantine for those amount of days. Both of them.
That's right. Mm-hmm. From the day of exposure, 14 days later, just stay home, work at home, and stay away from other people.
Mm-hmm. This person says, I got the vaccine 5 days ago, but then just tested positive for COVID-19. Will I be able to get the second shot?
Short answer is yes. That's not an uncommon situation. We have heard about that several times. It speaks to how pervasive COVID is in our communities. So depending on your symptoms, you'll get some advice about when to get the next vaccine. Thankfully, most people with COVID don't get very sick, and so you really should be able to get your second vaccine on time, and just go ahead and plan on that.
This person is asking, what's the difference between the first shot and the booster shot?
Great question. We refer to them as different vaccines because you get one on day 1 and you get one on day 21 or day 28 after the first one. But the truth is the vaccines are the same. The Pfizer vaccine is the same Pfizer to Pfizer, and the Moderna vaccine is the same Moderna to Moderna.
Interesting, because you're kind of thinking that there must be something else in it for it to be the second shot, but it is just a help to the first shot to make sure that everything is there. Okay. We appreciate your time, your expertise, and your explaining of what's going on with the appointments and how people will be alerted in some form or fashion. They will be communicated with to reschedule those appointments. Thank you so much, Dr. Swords. We appreciate it. Thank you for your text questions.